I want to talk to you for a minute about a parasite, a very serious parasite for all of us that live in the Great Lakes area and Northeast. And that is called the deer liver fluke or Phasaloides magna. I have a couple of ewes here. Most of these are ewe lambs, by the way, but there's two adult ewes. That one right front and center there. And you can tell she's kind of in thin shape. And we've got this ewe who's actually losing some wool. She's got wool break. You can kind of see it more on the top there. And she also is very thin. Now both of these ewes are looking a lot better than they did. Here they are together. They're looking a lot better than they did a couple of months ago. In contrast, here's actually an old ewe who's starting to lose teeth. Look at the body condition she's in. This is the body condition of their contemporaries, with a lot of these ewes being the same age. So they're out of the same age group, same sires, with one or two exceptions. But like that ewe for sure, right there, is part of their group. Look at the body condition compared to these two ewes. Deer liver fluke is a parasite that in a deer it lives in the bile duct and lays eggs. But a deer doesn't have a gallbladder and a sheep does. And because of the gallbladder, it gets a little confused and it winds up wandering through the liver until it literally destroys the liver. So what's going on with these two ewes that are kind of thin, not her, but they're in the back there. These ewes that are thin is that their liver is not functioning properly and they can't metabolize their feed like they should. Now, to some extent, the damage will be repaired over time, but the biggest thing is we need to manage this. What I do on my farm is I use Valbazin, and I use it in September, November, and March. And you got to do the March one as well, because really this is not the perfect drug for deer liver flukes, and it tends to get 75% of the adults each time you use it, so therefore you have to repeat it. And what I do is I give the doses 60 days apart in September and November, and then again in March after they're past the first trimester of pregnancy. You cannot use this drug during early pregnancy. It'll cause deformities and abortions. Ask me how I know. The problem we're facing right now is this has been back ordered for a very long time. I think the last time you could get it was last spring. It's been back ordered and they keep pushing it back. There's a manufacturing problem that they're having trouble. Now, I did find this product, which I found it in a Horse Supply online catalog, and it's the exact same product. What we're talking about here is the active ingredient there is albendazole. And this product here is also albendazole, and it's the same percentage, same dosage rate and everything. Now just a little tip, you do want to talk to your vet, but I find I give 1.5 times the recommended dose to adults, and I give 2 times the recommended dose to lambs. And I've done that for many years. Actually, there's a pretty big safety margin with this product. I had a friend that was doing it exactly as the label said, and she wound up with parasite resistance to this product very quickly. And although we do have some parasite resistance, this has remained a useful dewormer for us. But the biggest reason we use it is for deer liver flukes, the meningeal worms, and for tapeworms. Brings us to this girl, who, by the way, has, although she loves the sheep and the dogs, has become a lot more wary of me since she has regained her energy. I really do think she was starving when she got in here. Anyway, there was a discussion on one of my videos about biosecurity of having a deer hang out with your sheep. And there is, and the deer liver fluke is one of them. There's actually little chance of deer liver flukes living up here because they require a snail as an intermediate host. So they tend to be in the low laying areas where the forage gets flooded for some part of June, July, or August. So it's not a concern up here where we have nice and high and dry yards, but it will be a worry once she gets out into our pastures. Now I want to reach out to the veterinary community and tell you that we're going to have a real crisis in the sheep business, as I assume the only reason the Vetter product is available is because it just hasn't been used up. Because my understanding is there's a problem with the manufacturing of albendazole. If that's the case, we need a substitute to use next summer and fall. Otherwise, we're going to have a real problem, because those two ewes I just showed you, I was able to buy some Valbazin from a friend, and I treated them, and it saved their life, and they're still here, although they're not, as you saw, they're not in great shape. Those ewes would have been lost, and potentially I would have lost a lot more had I not dewormed the flock this fall. So I'm reaching out to you. I don't know what it takes to have emergency use of a product, but there are effective dewormers overseas that we are not allowed to use, even though the lamb that is produced in those countries is sold here in the US, and they got that product. So make it make sense, but we are probably going to need help if we can't solve this problem.